Hey everyone, welcome to the main event. Today is Tuesday, January 31st, 2024. Before I continue, I'd like to ask anyone in the chat room, is my audio coming through okay? Everything looks fine on my end. And I'm asking because I had to dismantle my studio because there was a flood in the building about a week and a half ago. And yeah, it was a pain in the ass. So I actually had to reassemble a makeshift studio in the same place because everything's dried and everything's good. There was not really any damage to speak of except for baseboards, and that was it. But it's a time-consuming process, and so I made a makeshift studio out of the old studio for Friday's show, which is why the background was, different lighting and everything. But for today's episode of the main event, I do have a little bit of my gear back in, more so than last time. So yeah, that's why I was asking. And it has been confirmed in the chat room. Thank you very much, Ken Kramer, saying that the sound is good. If you don't know who I am, what I'm doing behind this microphone, my name is Joe Tillman. I have been in the hair restoration and hair loss industry for a mind-boggling 22 years now. 21 years officially, yeah, but unofficially 22. And I have seen it all. I've seen far more bad than I have good, which makes seeing anything good in this industry that much better. It's kind of a strange way to say it, but it's unfortunate. It's not a very good industry to work in if you have any sort of ethics in your soul, because it will try your soul. It will try your ethics, and what is considered to be good in this industry it varies widely from clinic to clinic. And so about 10 years ago, I took the nickname that I was given online, being the hair transplant mentor, and I started to apply that working as an independent party in the industry, no longer working for a singular clinic. And I decided to apply this moniker to clinics that show a degree of ethics that I think is healthy, that show what I feel is good judgment when it comes to patient selection, patient care, and of course, putting out good results. And I started the Hair Transplant Mentor Review Program, where I do take on clinics, and I tell you guys, my subscribers and followers, about these clinics because I do think that they are worth considering. Obviously, there is a monthly fee that's involved with that, but I don't just accept anyone. If I did, there'd be a hell of a lot more clinics on this list. But one of the clinics and one of the doctors that did make it through to the other side is Dr. Joe Yaker out of Dallas, Texas. It's been a couple years since he came on board, and one of the things I like to do is to review, not just before I accept a clinic and a doctor, but I'm always evaluating, and I'm really happy to say that Dr. Yaker has continued to show some really great results, really great ethics. And one thing I really like about this guy is when it comes to patient education, there are few clinics on this planet that match this guy for how he is educating patients and making sure that they understand what they're getting themselves into. So everyone like to introduce Dr. Joe Yaker here right next to me on the screen. Doc, how you doing?
I'm good. Thanks for having me again.
Excellent. Glad you could come back. Just want to make sure everyone in the, okay, so PJP says live stopped. Well, that's on your end, I think. Yeah, everyone in the chat room, can you hear Dr. Yaker? We'll make sure the sound is good on his end as well. Hello from Bosnia. Oh, hey, man. How's it going? Great channel. Best for hair loss information. I appreciate that. Thank you very much. So while we're waiting for some confirmation, Doc, So Rob Harrington says we can hear you. That's great.
Great.
So this is going to be a live call-in, so you guys can call in and ask Dr. Yaker questions about hair loss, hair restoration surgery, medications, things like that. We will be taking your calls here in just a bit. But before we do, I'd like for Dr. Yaker just to give us an update. What's going on at the clinic? What's new? How are things going for you?
Things are going great. Thanks for asking. When, as you kind of evolve as an educator, you hear a lot of things, you see a lot of things, and it's kind of what you alluded to earlier. There's a ton of bad seeds in this field. And aside from hair restoration, whether you're an attorney, a businessman, there's always good and bad. But what I've kind of realized is hair has kind of two paths. There's the cosmetic beauty market side, and then there's the medical side.
Yeah.
But the vultures from the beauty side are grabbing the vulnerable patients on the medical side.
Well said.
And what I try to tell patients is if a shampoo, conditioner, and a supplement would help your hair or bring your hair back, I'd be a plumber because I'm not good at anything else. Amazon products, things online are not it. And typically, I'd say easily 50% of patients that come to see me, they've already tried everything and they realize it's not working. So it's really part of just the billion-dollar beauty market industry that slaps a label on a really nice bottle, puts this nice messaging where we feel so bad for you, try this. And we never were taught how to read labels in school. So someone's taking a multivitamin and then they're taking, I won't say names, but certain hair companies. And all it is just a few vitamins here or there with a little selenium here, a little copper, little hot words here or there. And then you end up looking that they're taking 3 different things that all have vitamin C and all have vitamin B. And that's the kind of the way I tried to educate. So when I started my practice almost 10 years ago, I needed to get to the below the surface and understand how did we get here. Yep. And so that's really how I tell my patients, this is a blueprint. It's not just about the hair loss. It's also about the hair health. Things you thought you knew, things that we were told since we were young, whether it's family, friends, hairstylists, it all just is this propagated theory and myth, kind of old wives' tale, and no one ever stops to say, is that really real? So when I have a patient that comes in that washes their hair once a week because that's what they were told, or they think is when they rub their hands in the shower, they're causing their hair loss. And I explain to them, there is no difference between your scalp, your face, and your body. It's all one skin. And if you know that you get dirty and you hold on to oil, sweat, debris, dead skin cells every day, everywhere else, and you're good about washing, why are we neglecting the scalp? And that's really what a shampoo is. It's just not sexy to say a shampoo is for scalps, it's for hair. And that's where that beauty market comes in. So I really try to educate people a little bit more granular. I don't just talk, again, as I said earlier, about hair loss and genetics and what's going on. But if our scalp is like soil, the crops aren't going to grow well. We have to understand that scalp health is extremely important for hair cycles and just for your hair to be able to thrive.
Well said, well said. And, it's interesting. I was thinking about some calls I've had in the past couple of episodes where patients are talking about, issues with their hair that's preventing them from having surgery, like some sort of, dermatological issue. And they're telling me the things that they're doing to treat it. And I have to stop them and say, well, okay, that's fine. You're treating the symptoms, but you're not treating the actual problem. What are you doing to find out what the root cause is? And it comes down to, the shampoos and lotions and stuff. They don't really do anything. I mean, when it comes to hair loss, there's really not much there that you can talk about that does anything. But when it comes to, the symptoms of other scalp conditions, yeah, you can treat those and reduce inflammation and cause flaking to be less so, but you're not dealing with the underlying cause, just the symptoms. And I think that the way that you approach the education on how these different things work, there's someone in the chat room just saying that they contacted you and you were very educational, professional throughout, and that's what I appreciate about you and how you do approach. You're not looking to pull people in. You want to make sure that everything is right for them, but also right for you, and that's part of the whole education process.
Well, and also, I may be a doctor of hair, but I'm also a patient to a doctor in some realm, right? Whether it's
Yeah.
orthopedic or dermatologic. So I'm going to want the same thing. I'm not here to push or pressure. This is, even though it's very emotional, this is also still a luxury. And if anyone is pressuring you to sign on the dotted line right when you've met that doctor, is, in my opinion, unethical. They need time to process. If they've had multiple different consultations, they need to process what was the difference between the physicians. And you're not going to lose more hair tonight. Take your time to process and absorb. And we send a very comprehensive post-consultation email. The beginning will have recommendations tailored for the patient, and then we send links. Let's learn about generic medications. Let's learn about the fact that the majority of supplements out there are not regulated.
Yeah.
And anyone can slap, again, a label and say, this is pure, this is quality, this is what you need. And then inside the actual bottle, it's not very good quality of anything. So we really try to tell people, we're not here to get you on our stuff. We're here to give you the blueprint so that you can cut out the noise from people and from social media. When something new comes out, you go, that is not going to work for me because I understand what I need for my scalp, my hair shaft, and my hair seed.
That's so important. That's so important to teach them how to filter out the noise. That's great. So I'll go ahead and give the phone number out. It's 1-888-491-0512. That is toll-free in North America. You can call in and ask Dr. Yaker anything you like about hair loss and hair restoration. Again, that's 1-888-491-0512. Callers in the UK can also ring us up. It is 044-20-8126. 7771. Anyone that's watching can look over in the bottom right-hand corner of your screen and see the numbers to give us a call. While we're waiting for the next call to come in, Doc, go ahead and tell us any updates on your clinic, anything new that's going on, what's happening as far as, before we get there, I got a call. Hold on. Hey, you're on the phone with Joe and Dr. Yaker. What's your name? Where are you calling from?
Hey, Joe. Hey, it's Thomas from Italy.
Thomas from Italy. Hey, Thomas.
Hi. I'm well, thank you. And hi, Dr. Yaker.
How are you?
I had a question for both of you, I guess.
Okay.
It's not really related to me, but I've come across, I feel, one too many stories of women, hair loss sufferers, that they're not responding to traditional therapy. I mean, androgenic alopecia sufferers. And they want to try finasteride, dutasteride, bicalutamide, and they're having trouble finding a doctor who will agree to prescribe it to them.
Mm-hmm.
So I tried suggesting on the female hair loss site, why don't you start a list of doctors who are willing to do that, and with their consent to appear on the list. And it was taken down by the moderator.
Okay.
And I was thinking, what if I started a website? Is there a reason why that's not a good idea?
I'm sorry. Before Dr. Yaker answers, let me just clarify. You said that you were asking, I guess, somewhere online.
On the female hair loss subreddit.
Oh, okay. Oh, on a subreddit. Okay. Oh boy. Yeah. All right. So you're on Reddit and you're asking about doctors that will help women with hair loss that have exhausted all the traditional means and are looking for treatments such as finasteride, dutasteride, like that. You're asking about starting a list of doctors that have agreed to be listed and to say that, yeah, we treat this or we can treat women in this way, and that was taken down by the moderators on the subreddit. And you want to know if it's okay to start a website that has a list of these doctors.
Yes.
Yeah.
I mean, with their consent.
No, of course. Fair enough. Yeah. I'll let Dr. Yaker start with that one.
Well, this is a long-winded answer, but female hair loss is different than male hair loss in certain regards, but it is more complex. So if you think of a boat and there's multiple leaks, if we do give medication, but there's still other leaks in the boat, medication can only help so much. So when we talk about women with genetic hair loss, it can happen in young ages, teens, 20s, but it tends to get worse once they hit 40 and older, and that's due to a bunch of shifts in their hormones. So as their estrogen and progesterone drops, their testosterone drops too, but sometimes the estrogen and progesterone ratio to testosterone had such a change that it almost makes testosterone a little bit more concentrated. So when I see a female patient, I really have to throw the kitchen sink. I need to see blood work. We know that vitamin and mineral deficiencies can contribute. We know that thyroid, another hormone, can contribute. So I really try to look at everything from that person. But the biggest thing I'm seeing, and this is at least 3 to 5 patients per day, both male and female, everyone is getting on testosterone, whether they need it or whether they don't. They think they need it because their friends are doing it or the doctor tells them to, and they're getting on levels too high. The one question I wish every hormone specialist would ask before starting anyone on testosterone: do you or anyone from your family suffer from hair loss? Because hormone doctors are trying to get you optimized or anti-aging levels. And these are levels that are very, very high and oftentimes outside a normal range. So, for example, a woman 19 years or older, 18 years or older, should be between a total testosterone level between 8 and 60. I had a woman 2 weeks ago, her levels were 17 times higher, and she's been on hormones for 15 years. So the amount of hair changes that can happen with that, if there's really not much estrogen or progesterone because they're only taking testosterone. Estrogen does 300 positive benefits for a woman, and when it comes to hair, it keeps your hair very supple. Progesterone is almost a very weak finasteride, if you will. It helps to try to limit the formation of DHT. It doesn't work in the same capacity as finasteride and dutasteride, but that's really what progesterone can help with. But when guys are coming in or women are coming in and they're pretty sedentary, they're not very active from a workout level or just their day-to-day, and they're coming in with levels that are so high, they have been programmed that this is what they need. And these doctors are trying to get them as high as they can to make them feel good, but also so that they keep coming back for the cash pay. And for me, Joe Schmo just met this person and says, hey, listen, you're a 67-year-old male, your levels are at 1,200. Someone of your age should be anywhere between 200 or 300 at the low end, and maybe 700 or 800, and they're starting them so high. To be able to convince a patient that what they're doing is wrong from that level is very difficult. But going back to that boat, any doctor can prescribe medicine, but if the other things are not corrected, we're not going to see the benefit, if you will, when everything actually is working cohesively. So back to your question about women, I do prescribe finasteride. We typically do it as a topical. We want to make sure that the woman is not pregnant. If she is family planning or plans in the future, she would need to stop. Birth control is an important step as well. But if someone had a tubal ligation or a hysterectomy or no chance of being pregnant, it really is not going to be a concern. When it comes to specifically how DHT affects women, it's a little bit murky. We really just don't have that exact answer as we do with men. But from our patient population, we are definitely seeing, when you combine finasteride with minoxidil, we are seeing the results that we were hoping for. And we would be more than happy to prescribe as long as they're a candidate.
How's that for an answer?
Well, I appreciate the answer, but it doesn't really answer my question.
Well, as far as the main part of your question was about whether or not it's okay to start a website where doctors that agree to treat women on that level can be listed.
Yeah,
I think I don't see any problem with that. Of course, contact each clinic, and I think what you need to make sure that you do is you don't just say this doctor will treat you for XYZ. You need to have more of a comprehensive get my camera to more of a comprehensive overview of what it is they offer in that respect, in that regard, and and just go from there. Like I don't see any problem with that at all. Doc, what do you think? Do you see any problem with that?
Not at all.
Yeah. And I'll tell you why your list was probably taken down. It's probably taken down because, and this is like I have no idea how this subreddit is managed or moderated. I don't even know about it. I don't think I've ever seen it. It was most likely because there is a monetary effect going on with that particular subreddit. Like maybe there are doctors that are involved with it, or maybe there's actually a doctor that does operate it himself or herself, or maybe they have agreements with certain doctors where if you're naming doctors that aren't a part of that arrangement, then you're stepping on some toes. Okay. So that could be why that was taken down.
Or referral fees that, there might be some terms and conditions. Yeah.
Exactly. Yeah. Does that make sense?
Right. Yeah. Oh, sorry. I think, okay. So you thought I was asking also in terms of if it's okay to take these medications. You thought I was asking if that's why I was taken down, maybe.
Well, I don't know. I don't know if that had anything to do with it. But I mean, the idea of women taking finasteride and dutasteride, that's fairly controversial if the doctor isn't well versed on that subject. Mm-hmm. Because we're trained when it comes to 5-alpha reductase inhibitors not to touch them if you're a female. Like if you're even thinking about having a kid, do not touch these medications because of and I mean, honestly, I think it's overblown, especially
it's never been proven. Finasteride's been around.
If you've been off it for you've been off it for a while.
Of course, but regardless, it is there's nothing wrong with being safe, but because of the way that people have been trained to deal with these medications, they may have also just felt it wasn't safe to put that out there because they don't understand. I don't know what else it could have been, but ultimately, it's their subreddit and they're going to run it the way they want to. So if you just want to put out a list of doctors that say that they will treat women based on these parameters, sure. I don't. You're not making a recommendation. You're not vouching for them. You're just saying these are the doctors that say that they will treat female hair loss issues in some cases using finasteride, dutasteride, if it makes sense for the patient. Right. Cover your ass when you do that, because you don't want to say this doctor says this, that, or that, because the doctor could come after you, patients could come after you, you could be held liable if something goes wrong. So you got to be very careful with how you word your copy on this website. Okay?
Okay.
All right. Any other questions?
And have you heard much of bicalutamide?
I've heard a little bit about it, but not a whole lot. Doc, how about you?
Very little.
Yeah. It's one of the bro science ingredients as far as we're concerned.
Oh, I mean,
there are several.
Yeah, several of them. Okay?
Okay.
All right. Thanks for calling. All right. The number is 1-888-491-0512. If you're in the UK, you can call in also 044-2081-267771. I always find it interesting, these bro science ingredients. Was it pyrolutamide? I forgot how to pronounce it. That seems to be, the one that's got the most kick when it comes to some sort of, I don't want to say measurable result, but people reporting that they're getting something out of it. But it's just the latest flavor of the month as far as I'm concerned when it comes to bro science ingredients. I'm always asked, well, why don't you look at this study? Why don't you look at that study? Well, every time I look at these studies, they're not actual studies. It's
Well, and that's actually a very important topic. When patients come in, there's a difference between reading something and interpreting something.
Yeah.
And so
Hey,
when they
hold on a
read
second,
us,
Doc. Hold
yeah,
on.
sure.
Caller, Doc's got something he's got to say, and we'll get back to you in just a second, okay? Hold on. Go ahead, Doc.
So just reading and interpreting are two different things. I can read how to fly a plane, but I can't get behind it, get up and start flying. So people get excited when they have a study, but most studies are flawed. In the hair world, it's usually very small patient population. So you can't take a study of 30 patients and say, this is it, this is going to be the new medicine out there. And so that's what I try to tell patients. We need to be able to decipher what's real and what's not, because especially in a cosmetic field, everyone's looking for the next buzzword. And every year there seems to be one or two. And then you actually look at that study, and unless you have experience in knowing how to extrapolate from a study, all it is just something that you've read online. And so we want patients to understand that just because there's quote unquote a study doesn't mean that it's true. It doesn't mean that it actually works.
Well said. Yeah, well said. All right, let's get to the phone call. Hey, caller, you're on the air with Dr. Yaker and Joe. What's your name and where are you calling from?
Hey, Joe, it's Yanni from Vancouver.
Hey, Yanni from Vancouver. How are you?
I'm good. How you doing?
Good, buddy. What's going on?
Hey, I got a question for you guys, because you were talking about cleaning your scalp and, treating it like your skin. Because I kind of hadn't been doing that for a while. I was more doing the once a week, trying to stay away from washing it too much.
Mm-hmm.
But I recently started doing it, and I'm also using Rogaine and finasteride. And, as I'm kind of doing that, I'm seeing some new growth come in, and I'm just wondering, how much regrowth can you expect to see if you kind of change your routine and start, taking care of your scalp better? Is there like a percentage of hair growth that you can expect to see? And how long does it take before regrowth is even out the window? Is there a certain amount of time? If it's been 5 years that you've been losing your hair, is there a point of time where it stops and you can't even see that regrowth come back from using finasteride and using Rogaine and that kind of stuff?
Dr. Yaker?
Sure. So with the scalp, what I tell patients, and this is a universal thing, when someone tells you that you shouldn't wash your hair every day because it strips your hair of its natural oils or that it's causing your hair loss, these are antiquated things. We have to remember that the most amount of oil production is on our scalp. So just like when you wake up with a shiny face and you wash it off, by the end of the day, your face is shiny again. Your body wants to produce more oil once you've removed it. And then when you do remove it, you'll have a good amount of skin that's not shiny, if you will. It's not oily, but by the end of the day, it is. So when it comes to shampoos, it's not the smell, it's not the brand, it's the pH level. Your scalp and your hair are extremely acidic. And when we have that buildup of oil, sweat, debris, dead skin cells, hair products, Rogaine, what have you, the pH levels rise. And your skin has this invisible force field called the acid mantle. So if the word acid is in the name, we've got to get it back down into that acidic state. That's the happy state. By doing that, it can maintain the integrity of your skin to try to minimize any invasion from bacteria or fungus. People hear the term dandruff and seborrheic dermatitis all the time. What that is fungus. We all make it. But 50% of the population has an overgrowth of fungus. And that's when we start to see the buildup and the flaking. The itching and the redness would be more your seborrheic dermatitis. So if fungus loves darkness and moisture is coming from all the oil buildup. And the darkness is, if you still have some hair, it's kind of shading the ability for light to get in. But the fungus is actually eating all your scalp buildup. But fungus also will thrive in an alkaline environment. So if you reacidify your skin and sweep away that dirt, there's no food for it to eat. It's now in an acidic environment where it won't thrive, and you don't have all that moisture. So we have patients that without having to go on specialty shampoos or even prescription shampoos for dandruff or seborrheic dermatitis, just using an acidic shampoo and conditioner often will treat it or try to minimize any flare-ups because there is no cure. It tends to get worse in the winter. So we tell people to be a little bit more vigilant in the winter, but you have to get that scalp acidity back each and every day. If you grab your face wash right now, it's acidic. That's the same principle. There's no difference between this skin on the face or just a few inches up above on your scalp. When it comes to the hair, your hair is made of water and protein. And when the pH levels rise on your hair, because all the scalp plaque will start to drift towards it, your hair window is called the cuticle, and it'll start to kind of flail out or splay open. Water is going to rush out, and your hair is going to become more dry, flat, brittle, and it's going to have a lower tolerance to frizzing because there's static electricity that is also being affected. So when you reacidify the actual hair shaft, the cuticles will seal. That seals in moisture, and then you develop more softness, more shine, more fullness, if you will, because your hair is hydrated. If the rest of your hair is protein, we need to make sure that we're consuming protein every day. And a lot of people are on the go. They're not thinking about protein. I always tell people there's an online protein calculator where you put your age, your weight, your activity level, and it can give you a roundabout answer for protein. But if muscles need water and protein, so does your hair. And so we know that to minimize brittleness of our hair due to weather, pollution, hair appliances, and hair products, as the hair leaves the skin, the drier it's going to get. And if you have very curly or wavy hair, you're more prone to dryness because the oils can't have that direct path to your hair because it's not straight. That's why you'll hear people complain of more dryness when they're curly or wavy. So the thing we always want to look for is a pH level between 4.0 and 5.0 for your shampoo and conditioner. All these companies out there, they don't list the pH levels on their bottle. You can try and Google it or contact customer service, or you can just buy the litmus paper, go back to science classes when you were younger. But a significant percentage of shampoos and conditioners are above 5.5. We've got to keep it acidic.
I just want to make sure that everyone understands that you heard it here first. Dr. Joseph Yaker, YakerHairMD.com, recommends using mouthwash to clean your scalp. Just kidding. So the other question that Yanni
That's part one of his question. Yeah. So the second part of your question is, I just want to educate you on that because you're starting to get an understanding why you need a wash, but that's the reason why, and making sure your pH levels are appropriate. When it comes to, will it make your hair potentially regrow better? What are the percentages? It's really impossible, right? Everybody's a unique fingerprint. Everybody's going to experience different rates of rethickening versus stability. How long will you be able to keep those results? But the question number 3 that you asked about, if I've been bald for a little bit, how many years is it until maybe we can get some regrowth? It depends. Some people say between 3 and 5 years. The bottom line is this: seeds don't fall out when you go bald. That DHT attacks the hair cycles can no longer be made. And if the kitchen is closed and the seeds are no longer growing more hair shafts, the pore or the hole where the hair comes out seals over with skin. So if you're smooth and shiny, there's really not going to be that pore. But is there a chance where before those seeds actually turn off for good, that we can revitalize it? The answer is yes. And so we'll see patients, we take pictures, and they look like they have hair where they literally looked like there was no chance of it coming back. And that tells me and the patient, clearly the seed was alive and we were able to catch it before it turned off officially.
That's a great way of putting it. And in my experience, Yanni, I've seen a lot of patients that look like they are, Formica bald, like there's no hair, but in reality they do have very fine vellus hairs, peach hairs, if you want to call them that can have some sort of rejuvenation as far as length, hair shaft diameter, and melanin production. They can get darker as they get longer and thicker. Those cases don't usually wind up with anything that is, something that can be combed. I'll put it like that. But in cases where patients are more diffused, where they're not bald, they're just thin, there's a lot of potential in that area. That area is usually got a lot of potential fertility if the right application is used. I've seen some. I was actually looking at some turnarounds today that Dr. Yaker sent me with one of his topicals, and it's pretty shocking. Some of the turnarounds that can be accomplished with seemingly bald guys. So there's potential, as long as there's hair that you can see, then there's potential for that to turn around. And as far as like how long does it take to get any sort of percentage of measurable regrowth that you can be happy with, that's what makes you happy. Like how much hair growth you get back is the main question on that. But I think it's the standard timeline of how finasteride or dutasteride or Rogaine works. You'll see a final result on these types of applications in 1 to 2 years, depending on what it is. Because when you look at finasteride, the efficacy curve on that, it flattens out at like 2 years, I believe, and roughly the same for dutasteride. For minoxidil, I don't know what the curve is on that one. Doc, do you know what that is?
But I will tell you, when we put a patient on medication, the first 100 days, think of the seeds undergoing an audit phase. They're going to investigate what it doesn't like, and then it's going to throw those back into the shed phase so that same seed can start to a fresh cycle, right?
Yeah.
So we don't fix problems, we get rid of them and allow a fresh flower to bloom if you're going to rethicken.
Yeah.
So a lot of people, first question I ask is, how long did you try? Oh, I tried for a week. I tried for a month. I wish hair medicines worked like Advil, and in 30 minutes you notice a change. But patience and compliance are the only two things that we ask of patients, because cycles cannot be manipulated. And once they've been thrust into the new phase to start growing, hair takes time to grow. It's under the skin. So some people start to see things at the end of the third or the beginning of the fourth month. Some people are late bloomers. I actually don't see my patients back for a full 9 months, because it will take some time. And then after that 9-month follow-up, you see patients annually for surveillance, and they still look better. So absolutely, I tell people 12, 15, 18 months in some cases. And I have had a patient take 2 years or more, and it kept getting better. I think that is due to the fact that there's external factors that are also involved.
Mm-hmm. Okay, fair enough. Yanni, got any more questions?
Thank you. I got one more, because you guys answered them all awesomely, so I appreciate it. The last one is, I've got one of those rollers with the little spikes that you can roll up and down your scalp.
Mm-hmm.
Do you guys recommend, or is it a smart idea to roll before you put Rogaine on? Because I feel like it opens up the pores, and then the Rogaine would kind of go in there better. I was just wondering if that's something you advise or don't advise.
Doc?
So a lot of people come in here looking at the studies that were done a couple years ago, and I at the time I told them, I said, listen, I think it's painful. I don't think there's going to be a major change, but I also know that this is a lifelong treatment. The chances of a person microneedling their scalp for the rest of their lives is 0 to none. We also have to remember that you're doing it a couple of times a week for months, years, however long you're willing to do it. That's going to create some damage, because it's creating irritation and inflammation, which is supposed to then support the whole healing cascade and collagen. But every time you create trauma to the skin, there's going to be some form of micro scarring. So when a guy or a girl goes to a med spa and wants to have microneedling done to their face, they're not doing it twice a week for the rest of their lives. And so it's my belief that if you're creating that much trauma long term, I don't think it's going to lead to good quality skin, because it's going to be irritated every week and leading to some minor scar formation. So there was another study that came out in believe at the beginning of this year, and the results were kind of inconclusive. So again, going back to studies, just because there's one does not mean it's 100% true and accurate.
Yeah, and the idea of creating openings for the medication to channel itself down into for maximum efficacy, it makes sense on the surface level, but then when you think about it, it's like, you are wounding the skin multiple times a week, or how often you're doing it, and even any micro scarring that you're getting, it can accumulate potentially over time, creating more problems than benefits. Just a potential on that. So, these medications were designed to permeate the scalp, to absorb in certain ways. Just let them do their job.
Okay.
Yeah.
Perfect.
All right.
Well, thanks, guys. I appreciate it.
All right. Thanks for
You're
calling.
welcome.
Take care.
Thank you.
Bye-bye.
Thank you.
Hey, Doc, before we take another call, can you do you have the YouTube, do you have YouTube open right now?
No, but I can.
No, because I was noticing the playback that we can hear the show coming back through on your speaker. I think
I don't know.
I was testing that. Anyone in the chat room, can you hear the show coming back through on Dr. Yaker's side when he's speaking? Let me know in the chat. It's not bad, but I was thinking if you had it open, we could just shut that down. It's still workable. It's fine. Anyway, phone number is 1-888-491-0512. Dr. Joseph Yaker is here to take your questions. You can also call in from the UK. The number is 044-20812-67771. Let's see, yeah, someone in the chat room says, don't notice it, don't hear a playback. Okay, maybe it's just me. All right, well, that's good.
The voices in your head.
Well, and they're always battling, so, who knows what to do. All right, we got a call coming in. Hey, you're on the main event. What's your name and where are you calling from?
Hey, this is Hampton from Atlanta, Georgia.
Hampton from Atlanta, Georgia. How you doing, sir?
Doing well. How are y'all?
Can't complain, buddy. What's going on?
Hey, yeah, I just wanted to, ever since you last had Yaker on it, he really impressed me, so I had some questions for him.
He's an impressive kind of guy.
Thanks.
For sure.
Go ahead.
I'll pay you later.
I actually flew out to Texas to buy a truck, and I wish I would have stopped by his office, but, hindsight's 2020.
Next time.
So, I'm on topical finasteride.
Mm-hmm.
And I'm just wondering, I have a few questions about it, but what's the dosages you prescribe? Right now I'm on 0.5% finasteride, and it's a mixture of 0.5 with 5% minoxidil and 0.02 tretinoin.
What was your tretinoin?
0.02%.
So studies on the topical finasteride part, if we talk about the concentration, there's studies that show that very, very low doses are actually still showing some form of reduction of DHT at the scalp level, which leads to stability and or improvement. When I was working with a pharmacy in 2017 to figure out what was going to be really the middle ground by looking at that research, we looked at 0.05%, we looked at 0.1%. I have some patients that will have a topical formulation coming from overseas or even, local dermatologists. We have always been I don't know if you can see this here, but I think it has it on here. This here, we've always been with 0.25%, and that's been since 2017. I find that with all the years that we've been doing this, and we have about 2,200 patients, both men and women, on it, we've had maybe 5 or 6 sexual side effects. Never can a physician or a website say that topical finasteride doesn't cause sexual side effects, because just with placebo, less than 0.7% had a sexual dysfunction. So my goal is we want to make sure that it doesn't affect your sexual dysfunction, but also giving you the outcome that you're looking for. So it's really hard to say, because again, everyone will absorb and process medications differently. But with looking at our patient population, we found that 0.25% has worked very, very well. I'm not a fan of going higher than 5% on minoxidil. If you really look at those studies, you're going to have people that are going to try to go 8, 11, 12, random numbers, 14, because in this country, we're a super size game. We think more is better. But we have to remember that minoxidil can cause some considerable skin side effects. And any person that I see that's on 8% or more, their scalp looks like a lobster. and it's so irritated. And again, going back to the fact that we have to make sure the scalp is tip top and healthy, it creates such a problem, and to get them to back down is also hard. So I just stay in the realm of that 0.25%. Some people have gone higher, which is fine. Minoxidil 5%, and when you add that tretinoin, it allows for better penetration. So I don't think you can go wrong. It's just a matter of giving it the time. Did you give it a year? Did you get some re-thickening? Is it enough for you? And then if you feel like you want to try something else and go up in the dose, that's perfectly fine. But I don't think that there's ever going to be a universal dose, since everybody's going to process it differently.
Gotcha. So yeah, that's why I was asking in regards to what's most efficacious, and then also side effects. The first prescription I got was 0.1%, and this was over a year ago. 0.1% finasteride, 5% minoxidil, and it had lipoderm in it. And I actually did blood work, and my testosterone and DHT were both super high from the get. And when I got on the topical with the 0.1%, my testosterone increased by about 100, and my DHT was cut in half, going from 63 to about 35. And the reason I was asking is because I've been on medication for a year, the 0.5% finasteride, and I can still get erections on command. I don't have very noticeable side effects, but I don't get morning erections like I did before. So I've been kind of concerned about it. And I just don't know if I can chalk it up to being the topical or not.
Well, you're also
right. Well, right. So we have to remember that everything is not going to be what it was when we were in high school and in college, in our teens and 20s. So testosterone goes down as we get older. Our libido goes down when we get older. The nocturnal erections aren't going to be as well formed or as frequent when we're older. Having said that, if you had your baseline, you got on this medicine and you noticed a change, then it's a very strong likelihood that it's the medication. So what you could do is a little withdrawal test, get off of it for a week or so, see if those nocturnal erections get better. I will say a lot of patients will report some sort of issue with their morning wood, if you will. With oral finasteride, I see it much less with the topical version. But again, because everybody's sensitivity is different and the way someone absorbs may be different, it's important that you experiment with doses. So if this place where you're ordering it from has another dose that's much lower, you can maybe take a week or two, flush it out of your system, see if those erections are getting better, and then try something much lower. But doing something is better than doing nothing. So don't always focus on the milligram or the concentration. It's about what you and your body can handle so that you can enjoy your life with your hair and not having a concern about those erections.
Well said.
Thank you.
Yeah, it's tough because I can definitely, just based off my experience, I know it's from the medication because I just know my body. I'm 29 years old.
Yeah.
And I've always, when I initially got my testosterone checked, it was almost 900. And after being on the 0.1% finasteride, it shot up to almost 1,000 nanograms per deciliter. So I know that the medication was absorbed systemically based off those figures. And my estrogen went up as well. I got all these markers checked. And my fear is just coming off, obviously, going into a shed. So I've just been dealing with not having morning wood because, like I said, I can get an erection. It's not like I'm impotent or So it's kind of just a tough situation.
Right. And, when we're on a DHT blocker, think of us driving in a car on a highway and the exit is DHT. If there's a car wreck up ahead, it's going to bottleneck, right? So if we're lowering DHT by reducing the production of it, things can then go up. So testosterone can go up, depending on your literature, it can go anywhere between 4 or 5 to 13%. And then the estrogen also can go up, and that's where people get the gynecomastia. Because it's topical, and that's what I was referring to earlier, it can still get systemic. A few percentage points can actually get systemic. And if you're sensitive to even that little amount, that's when side effects can happen. So it always has to do with absorption, with your sensitivity versus tolerance, things like that. And that's why you'll always have patients have different responses. No different than us eating foods, right? Some people will have inflammation, so they need an anti-inflammatory diet, whereas we might be able to eat McDonald's and have no issues.
And don't forget, there's also the angle to approach this, Hampton, where if it's not broken, don't fix it. You know.
Yeah, and exactly. And that was my next question. From a doctor's standpoint, is lack of morning erections means to drop the medication? I'm not seeing anything else. Like I said, performance-wise, there's no difference. I'm not noticing any other side effects other than that. Is that means to look at lower doses?
Well, I'll go ahead and tell you what I think on this one. I think that, as you're getting older, you're 29 years old. Life gets in the way of these things sometimes. Different stressors in our lives. You're a big boy now. You're grown up, so you got different things in your life that are affecting you in different ways. We can't always go out and have pizza and beer and not expect. I'm not saying that's what you do, but things that we do in our lives as we get older will affect us differently as we get older than they did when we were younger. But I think it's also important to understand. I did an Instagram reel several weeks back with Bill Burr, where he was talking about, don't really. It comes down to, if it's not broken, don't fix it until it actually becomes an issue. So in your case, how I think that applies is, if you're not getting morning wood every morning like you used to, does that really mean anything? If you can still, to use your words, get an erection on command, like abracadabra, like, damn, son, good for you. Then what's
yourself in this kind of tailspin where you're waking up, do I have it, do I not? If it's something that is not affecting you other than that, and what we're talking about is being able to get erection when you need it to, and you're happy with the stability and or the improvements that you've seen to your hair, since there's never an off switch to hair loss, and we have a good thing going, and the only thing that's different is maybe the frequency of your morning woods. Well, I think you may have found your answer there.
Yeah.
Gotcha. I do have another question, and anybody that's on Topical, they could probably help them out to get a clear answer on this, is how long do you need to leave this stuff on your head? The compound that I use makes my hair look horrible. So it's not something I'm going to put on first thing in the morning and head out, for the day. It's something I do when I'm at home before bed.
So what I tell people is, what I tell people is this: think about how many things you do every day to just get out of the house, right? We have to shower, brush our teeth, things like that. So I want people to know, don't make this a chore. If this is forever and we focus on that, then we're not going to be compliant. I don't really mind at what time of day you do it, but if you're going to ask me personally, nighttime is best. And the reason why is you're winding down, you're not in a rush, you have your own nighttime routine of washing your face and brushing your teeth, hopefully. And when you apply it, it takes about 30 minutes to dry, but we need about 3 to 4 hours for it to absorb. So if you're sleeping, hopefully that much or more, you don't have to think about that during the day where it's affecting your hair. With our solution, we made it a little bit more water-based, and then when it dries, it holds your hair in place. So I have a majority of my men, especially the non-compliant ones that were not able to do it at night, they're using it as their hair product. And again, daily maintenance. You got to wash your hair, you got to style it, and they're using it. And then once it sets and holds in place, they're getting the absorption until they're ready to wash their hair for the next day. So you can consider just moving it to nighttime if it's making your hair look kind of clumpy.
Yeah, I just look like a grease ball with it on. So, not a good look for me.
And just so you know, Hampton, also Spencer's in the chat room, and he was saying, and he's right about this, that just because you're not getting morning wood doesn't mean that you're not having nocturnal erections. Because I remember reading something that average guy will have several nocturnal erections throughout the night. So maybe you still are. You're just not having them when you're not waking up in the middle of one. So there's also that very high probability to consider.
Right, and also psychosomatic part. I don't know how much I was paying attention to it before, So
yeah.
Well, that's common. Yeah, what you just said is extremely common.
Yeah, and Spencer says you can test it by using a roll of stamps. So have fun with that. Be sure to call back and let us know how it worked out. All right, buddy. Any other questions?
I guess my last thing is, like Dr. Yaker, I think he hit on it. We're told it's not healthy to wash your hair, but a couple times a week. Is it safe to say that if you're putting this topical on your head daily, washing your hair about every day is the thing to do?
Well, let's think about pores as drains. If your drain is clogged with a daily buildup of plaque, how efficient will that liquid get in? So it's even more important. The only time I tell people not to wash their hair every day, scalp essentially, both men and women, is if you have very sensitive skin or you have very dry and brittle hair. Because water, the pH level isn't great, depending especially on what part of the country or world you live in, right? So I do believe in shower head filters. The one that I recommend to my patients, I use myself, is called Jolie. No, I do not get paid by them. It's Jolie. You can get it on Amazon or direct, and it has filters. And every 90 days they send me filters. But the only people that should be washing their hair every day is going to be people who just have very sensitive skin. And other than that, and then you absolutely should. The no poo movement and the dry shampoo movement, very dangerous, because anything we put on our head is considered makeup. And if you let that sit and then you go to the gym and sweat and then you wait days to wash again, you're just letting all those ingredients get into the skin. And there was recently an article that came out that one of the dry shampoo companies, there was a cancer-causing agent that was in one of their chemicals. These companies are not regulated. You have to be careful. Just because you have access to it does not mean it's been regulated.
My favorite hairspray was recalled because of that exact same reason.
Yeah. A famous shampoo brand, I don't know if I'm allowed to say it, they claim to be so native. I had two guys actually yesterday back-to-back, coincidentally were on it, but I'm seeing more and more native. Number one, I couldn't find their pH level online, because when patients fill out their forms, I like to go online to know what the pH is before they come in. And I came across this potential lawsuit. Not only are they claiming that it's natural and organic, we have to remember those words don't mean anything. Anyone can use those words. It doesn't mean it is. And secondly, there was an ingredient there that is extremely toxic. Yeah. And that, again, is you guys just don't assume, hey, it's a shampoo. It can't be a problem because I have access to it. But absolutely, all these things can have ingredients that are dangerous.
I always refer to the fact that cyanide is natural.
That's right.
It's like natural doesn't mean it's good by default. So, all right.
And organic shampoos don't clean because there's no true cleansers in them. So when I put the dermatoscope on patients who are on all these tea tree shampoos and organic shampoos, their scalp is filled with plaque.
Yeah. There you go. So, all right, Hampton, I hope that helped you. You got some questions answered appropriately and to your satisfaction. Good hearing from you, buddy. Thanks for calling, all right? We'll talk to you another time.
I appreciate y'all.
All right, take care.
Take
Bye-bye.
care.
All right, 1-888-491, what is it, 0512. And if you're in the UK, you can call it 044-208-12-67771. Lines are open. We've got Dr. Joseph Yaker from Yaker Hair Restoration in Plano, Texas, which is a burb of Dallas, Fort Worth. What's weather there like right now, by the way? Is it cold, wet, snow? What's going on?
Well, the last couple of days have been amazing. 60s, 70s, sunny. But the
Nice.
last few weeks have been absolutely horrible. But yeah, finally we're getting a little bit of sunshine.
Just unrelated side question, just because I was curious, so I appreciate that.
Yeah.
Let's talk about unless we get another call in the next few seconds. Why don't you start in with topicals and your approach to topicals? There's someone in the chat room talking about taking one of your topicals now. What are the top things that you're looking for in when you're putting together these products for your patients?
So because it's a topical and the majority of our patients are healthy, they're not having to take things, it's very important that, just like the last caller, we want to make it so it's not clumpy, it's not greasy, it's not oily.
Mm-hmm.
When patients have tried or heard about minoxidil and Rogaine, they have to understand that this is made in mass quantities. Since it's over the counter, it's going to be sent everywhere. They put a lot of preservatives in it because it's bad for their business if it dries out on the shelf. But that's what leads to a lot of scalp irritation and a lot of that consistency. So when we wanted to make our own formulas, the first thing that we wanted to do was make something with quality. So not all bakeries are created equal. We can go on a chocolate cake tour, go to multiple places, all different ingredients come from different sources, the way it's made, etc. So don't assume that when you go and have a compounding pharmacy from your doctor make it, that it's just as good of quality as another place. So I wanted to set up a structure where the pharmacy was being honest with me, because if you can't tell, I'm Joe CD, and I was going to be just as Joe CD about delivering this to patients. So number one, where are the manufacturers coming from? Number two, must be made fresh. Number three, they have to send me purity reports so I can see the purity, the potency, are there any hidden fillers, things like that. When patients go for a cheaper place or go to the dermatologist or whoever who says, oh yeah, we can make it, I can guarantee you this, they have never stepped foot in that pharmacy. Mm-hmm. I go once a quarter, I go in, walk around, I put everything on to go under the hood. I have monthly meetings to make sure that everything is appropriate. And when you have a physician that's prescribing you something, that doesn't mean that they know where all the ingredients are coming from. So what we have noticed is there's a lot of competitors in this space that are making it. They're all getting the ingredients from most likely the same sources. Yeah. With this way that we're making it, we ensure that we know that the ingredients are coming from US and maybe a couple of European countries for a couple of our ingredients. But that is going to be number one. Number one is, if you're going to be ingesting this for the rest of your life, you better make sure you got good fuel for your body.
Yeah, no, it's well said. And you know, the thing about pharmacists that are offering this, or yeah, we can make this for you. I find that most pharmacists in general just don't even know the difference between name brand finasteride, Proscar, Propecia, and the generics, and they will tell their patients when they're coming in that essentially all generics are the same. And I find that to be very irresponsible, very ignorant, and even dangerous when it comes to different medications. Obviously, with finasteride, it's not going to be quite as dangerous, but there are other medications that are generic that are more important for keeping people alive, that can have adverse side effects or just not be potent enough to perform the way that they're supposed to perform compared to the original name brand, and lives are lost because of it. Was it 60 Minutes did an expose on this, or someone did a few years ago, and it was shocking. And so what you're talking about, I think it's refreshing. It's one of the things I loved hearing about when we first started talking about your topicals. And that's a great point that you bring up, is most of these pharmacists, and I would even venture to say most of the doctors that are prescribing it, have no idea.
Zero clue.
They have not been into the pharmacy, or they have not been to the pharmacy where it's made, and they've not been to, much less, to the locations where where the raw ingredients are made either. So that's very refreshing to hear that. I always love hearing that from you, and I think it's important for patients to understand that. Again, phone number is 1-888-491-0512. You can also call directly from the UK. I set that up for you guys. It's 044-20-812-67771. Lines are open. You can ask Dr. Yaker any question you like about hair loss and hair restoration. Of course, I'm here to answer your questions as well. What else can we talk about? What's going on? Okay. And the stream. Something happened to the internet. You can still hear me and see me.
Yeah, it just freezes every couple of seconds. Right now we're good.
Yeah.
Yeah.
Okay, and let me refresh show. Okay, it looks like we're back. Yeah, we're okay. That was strange. Yeah, that was internet. Like I've got a gigabit connection on my end, so it had to be something going on with the provider. There was a caller that had called in. It was from 718 area code. Please give us a call back. Sorry about that. I was dealing with the internet connection on this end. You're welcome to call back. Again, that was from area code 718. What were we talking about? I forgot what we were talking about.
I wanted to bring up a point about generic finasteride.
Oh yeah, go ahead.
It's so popular. Whether you go to your local pharmacy or you're going to these online sources, please know that 99+% of generic finasteride is coming from 2 third world countries.
Right.
So the purity, the quality, the dose, the effectiveness, and whether or not there's a bunch of fillers in there is what makes me not sleep well at night, because I'm on the medicine too. You're not going to trust the bald hair transplant surgeon that's like hiring a skinny chef. You're just not going to trust them. Right. So when I was going through this process, which took about a year until I was comfortable with it, you really find out a lot about the underbelly, not only about the beauty market, not only about the supplement market, but also about the generic market. And if we think about, and what we were talking about earlier is no 2 bakeries, no 2 manufacturers are alike. Pharmacies do not have to tell you when they change manufacturers. Exactly. So if you're on this medicine long enough, your pill color and or your pill shape will change. And so we get a lot of patients that go, it worked for me, and then all of a sudden I got a side effect years later, or it worked for me, and then I had a crazy shed. First question I ask is, did you notice anything different about your medicine? And the majority of the time it is. So we need to understand.
And he just froze.
Hello? No, I'm here.
No. I
and there's no one there to check.
I got you, caller. Dr. Yaker, you just froze there for a second. But we got a caller on the line. Caller, what's your name? Where are you calling from?
It's Morty from Brooklyn.
Hey, Morty, how you doing?
Hey, Morty.
I'm good, man. Just calling in to say hi to Dr. Yaker and to yourself, Joe.
Thank you very much. Good to hear from you.
In the area in the lower part of the crown, maybe not coming in as thick as it used to be. And again, the reason it's showing up more is because the area above the center of the crown, which did get a few hairs, it has a different texture. The lower half of the crown is growing pin straight down. The hair above has got much more of a wave to it. And the other thing that I'm also noticing over time is that the hair in the transplanted area is definitely a lot curlier or coilier than those particular hairs. And, again, it's been a year, and I don't expect too many more changes with respect to the hair that's been transplanted. And generally speaking, I'm pretty satisfied with it. But it's one of those things that, I've noticed, and I don't know, I wanted to get your opinion and Dr. Yaker's opinion. You've seen the picture I sent you, so.
Yeah. Well, and I'll just bring Dr. Yaker up to speed. So the caller, Dr. Yaker, he was a Formica 7.
Yes.
And he went through a couple of years of non-surgical treatments. He started finasteride. He did some PRP. He did some all these different treatments, and he was starting to get. He even started with a laser cap, and he was getting a nice noticeable amount of improvement, but of course it didn't get him where he ultimately wanted to be. So maintaining on medication, he did undergo 2 surgeries via FUE. Very nice result, natural, singles, angles, directions, everything on point, looking good. And now that he's got all this hair, he wants to be a picky little nilly, and
Absolutely.
and not enjoy it for what it is. Just saying. No, but
you know what?
We're used to that.
You're doing a really great Spencer impression, Joe. Just so that you know.
That's good. Thank you. But no, he's really come back from the brink, and he's looking good. But yeah, so I'll let you answer the question about how about the different textures in the transplanted hair, and then I'll give my take on it.
So there's a few reasons. Number one, when hair begins to grow in, it's for a lot of people will be a little bit more coarse and more kinky. It almost takes time for it to correct itself. Some people's 12 months. I've seen it take up to 24 months. If it's hair that was injured with traumatic entry using forceps, the staff was a little bit too aggressive, whether it was pinched or it was put in too deep, they're going to grow a little bit kinky as well. So without actually seeing you, it's really hard to determine, because there is a big difference between, okay, the hair is just a little kinky, needs to grow out, versus actually the hair was traumatically inserted. So I unfortunately won't be able to give you the exact answer. But the third possibility, which I see often, a lot of guys keep their hair kind of short, and in the back, the hair is kind of short. And now they're growing their hair longer, and now they have wave to it. That hair back there had a wave or it had a curl, but they've never had their hair to get to a certain length to actually show the wave or the curl. And now that they're growing their hair out, the curls happen. We also can have changes in our hair characteristics as we age. I used to have very flat, very, very straight hair. Now I've actually got body